Today, we're going to break down a really fascinating and kind of mysterious condition called myasthenia gravis. At its heart, it's an autoimmune disease. And what that means is the body's own defense system basically gets its wires crossed, and it starts to cause this really strange and puzzling muscle weakness that, well, it just doesn't seem to make sense at first. I mean, just imagine this for a second. You decide to lift your arm, or smile, or even just keep your eyes open, but the message from your brain to your muscles just fades out. It's like the signal gets lost along the way. That, right there, is the fundamental experience of this condition, a frustrating disconnect between what you want to do and what your body is actually able to do. So, where does a mystery like this even begin? Well, it usually starts pretty quietly. The first symptoms can be super confusing, and honestly, they're often mistaken for something else entirely. You know, one of the most common first clues is a painless, but definitely noticeable drooping of one or maybe both eyelids. And we're not talking about just being tired here. It's a very specific weakness in those tiny little muscles that are supposed to hold your eyelids up. And it's the same kind of deal with the muscles that control how your eyes move. When they start to weaken, they can't work together perfectly anymore. So your brain gets two slightly different images, and bam, you're seeing double. It's actually why so many of the first signs of this condition show up right around the eyes. Okay, and this right here, this is the absolute core concept that defines myasthenia gravis. It's a word you have to know: fatiguability. This is not your everyday feeling of being tired, not at all. This is a clinical sign where the more you use a specific muscle, the weaker it actually gets. So if you're talking for a while, your speech might start to slur. If you're chewing a meal, it can get really difficult by the last bite. The muscle works fine at first, but that signal just fades out fast. So what on earth is causing this strange, progressive weakness? Well, this brings us to the real heart of the problem. It's a case of the body turning on itself. It's a betrayal from within. Think about it. Normally, your immune system is your personal bodyguard, right? It's brilliant at hunting down viruses and bacteria, but in an autoimmune disease, it's like that bodyguard gets confused. It misidentifies your own perfectly healthy tissue as some kind of foreign invader, and it attacks. So let's get into how this attack actually works. The best way to think about it is like a lock and a key. Your nerve sends out a chemical messenger, that's acetylcholine, and it's our key. This key is perfectly shaped to fit into a special receptor on your muscle. That's the lock. When the key goes into the lock and turns, boom, the muscle contracts. Simple, right? But in myasthenia gravis, the immune system makes these rogue antibodies that are like gum somebody jammed into the lock. The key can't get in, or at least not as easily, so the muscle just never gets the message to move. Okay, so with these really unique symptoms and this very specific cause, how do doctors actually figure it all out? How do they confirm a diagnosis? It's actually a pretty cool piece of medical detective work. Doctors have a few key tools they use to crack the case. First, a simple blood test can look for those specific lock-clogging antibodies. Then, they can do something called an EMG, which measures how your muscles respond. With this test, they can literally watch the muscle get weaker with repeated nerve signals. It's a direct confirmation of that fatiguability we talked about. And finally, they'll often do a CT or MRI scan of the chest, because the thymus gland, a little organ that's part of your immune system, is sometimes involved. And check this out. This describes an older but incredibly powerful diagnostic tool called the tensilin test. What they would do is inject a drug that temporarily floods the area with more of that chemical messenger, more of the keys. If the person has myasthenia gravis, the effect is almost instant, and honestly, it's just dramatic. A drooping eyelid can snap right open. It's this powerful, real-time proof that the problem is that communication breakdown. So once the mystery is solved, the focus obviously shifts to management. And while there isn't a cure just yet, there is a very effective toolkit of treatments to help manage the symptoms and control the disease. The approach really has a lot of different angles. Often, the first line of defense is a medication that helps that key, the acetylcholine, stick around longer at the muscle. That gives it more chances to find an open lock. For more serious cases, you have therapies that tackle the root cause by either suppressing the immune system or by literally filtering those bad antibodies out of the blood. And in certain situations, surgically removing the thymus gland can actually help rebalance the whole immune response. But what happens when that weakness becomes so severe that it's actually life-threatening? Well, this is a true medical emergency, and it's known as a myasthenic crisis. A crisis is basically when the weakness gets so profound that it affects the muscles you need to breathe. Your diaphragm, your chest muscles, they just become too weak to move enough air, and that can lead to respiratory failure. It can be triggered by things like an infection, a surgery, or even certain medications.
So, how do doctors know when it's getting to that critical point? Well, one of the key numbers they watch like a hawk is called vital capacity, or VC. It's just the maximum amount of air you can possibly breathe out after a big breath in. Now, a healthy adult should have a VC of several liters. If that number drops below 1 liter, that is a major red flag that the breathing muscles are failing.
And that brings us to the response, which is a very clear step-by-step protocol. First, doctors are constantly monitoring those breathing numbers. Second, they provide support like oxygen to keep everything stable. But if those critical thresholds get crossed, like that vital capacity dropping below 1 liter, then the final step is intervention. And that means intubation and putting the patient on a ventilator to take over the work of breathing. It protects them and buys time for other treatments to start working. And really, that leaves us with the ultimate question, doesn't it? We've gotten pretty good at managing the symptoms and even suppressing the attack. But the next great frontier, the real challenge for the future, is figuring out how to reteach the immune system at a fundamental level, how to help it remember the difference between a real enemy and a friend.